Okay, Dr. P here again. In this video, I'm going to talk about can tattoos cause disease? And I've known for years, like I said, I've been doing this 42 years here. I've known for years that tattoos have some effect on the functioning of the human body, namely affecting the autonomic nervous system, which is what we talked about earlier in earlier videos. So I'm just going to go over that real quick so you can kind of get a good understanding as to the nature of the autonomic nervous system. It's very important. Like we say, the mind controls the brain controls the autonomic nervous system, the autonomic nervous system controls everything else, every function in your body, especially your metabolism. So we know that this is a system of unconscious control of your respiratory system, your immune system, your cardiovascular system, digestive system, and the endocrine system. And it has two parts. The autonomic nervous system contains the sympathetic nervous system and the parasympathetic nervous system. That sympathetic portion is the controls your stress response, and the parasympathetic controls your rest and digest portion. Okay, and so they kind of work interchangeably. When one is on, the other is off, and vice versa. But it's according to your environment. It's according to the needs of the human body. This is a very important system. And keep in mind that there's no one supplement, there's no one nutrient, there's no one drug that's going to balance us here. We balance and put a lot of focus and emphasis on the vagus nerve, which controls a lot of your respiratory, the things I mentioned, cardiovascular, digestive, even some of your colon function. So, but the chiropractor will use multiple forms of care, and that's what we say. Combine these care modalities, naming the adjustment. That adjustment will balance the vagus nerve, what it does, okay? In addition to drainage through colon therapy, enemas that the patient can do on their own at home, and your diet. Diet is so important. So what we're seeing now with all these, it's like diseases are popping out of everywhere. What you're seeing is the effect of 50 to 60 years of processed foods. That's what you're seeing right now. It has an effect on the body. And really, these are not diseases at all. They're symptoms of malnutrition, starvation. The body's in starvation mode. The brain is starvation mode. You're going to see eventually that mental illness is related to starvation of the brain nutrients. I mean, the brain uses 25% of all your oxygen, 25% of all your energy from the body is used by the brain. So, but anyway, I wanted to make sure that you got an understanding of that. There are different nutrients. There's certain vitamins and minerals that one who has a dominant sympathetic nervous system cannot use in a certain type of diet. The nutrients, they're not beneficial. They can have an adverse effect on your body. Same way with the parasympathetic nervous system. You have certain vitamins and minerals and foods that are more conducive to the functioning of the parasympathetic nervous system that's not conducive to the functioning of the sympathetic nervous system. So this has got to be tested. Once you find it out, we benefit the patients more knowing this information because we can give them the actual supplements that they really need. A parasympathetic nervous system needs a lot of calcium. They need an acidic diet, a high protein, high fat diet. The sympathetic nervous system patients need a more vegetarian type diet. They need more magnesium and potassium-based products. They don't do very well with vitamin B12, which the parasympathetic nervous system patients do very well with, in addition to their calcium. So we need to have a knowledge of this information before administering this, and you need multiple forms of care. Like I said, there's no one food, there's no one supplement, there's no one treatment. You have to combine these things based on the patient's needs to achieve that desired effect. Now, can tattoos cause disease? Absolutely. I'm just going to read some information to you. I got this from the NIH and AI about tattoos and their effect on the autonomic nervous system. And one of the things I refuse to do over the years, of course, you don't acupuncture scars. Okay, you don't. Now, most of your scars, tattoos, piercings, they increase the sympathetic nervous system function. I mean, really increase that function. See, so here's a person who already has high blood pressure, and here's a point right in the corner of the elbow, large intestine 11, that you can stick with acupuncture needle to help to regulate or bring that blood pressure down, elevated blood pressure down. But what if a person has tattoos in that? They got tattoo ink all in the corner of the crease of the elbow, and you want to stick that point. Even with using traditional Chinese medicine, they have a what's called acupuncture without the needles, called nanolight therapy. I don't know the effect that I'm having on that person's. We're trying to bring the blood pressure down. I'm not sure of the effect that I have in shining the nanolight on large intestine 11 point in the crease of the elbow. And there's ink from a tattoo there. So I don't do it. Certainly you don't do it. Piercings. Some of you have piercings in the umbilicus. That's a forbidden point to acupuncture. We use moxibustion, where you put heat to the area to increase the chi or energy in that area, but you don't needle the point. You have piercings through the breast nipple. These are points that we do not stick with the acupuncture needles, nor do we nanolight with those particular points. And you have points everywhere. It's unbelievable the things that people do. So I'm not judging. I'm showing you the pathology involved with constant stimulation of these points. Now, right in the center here, straight down, this is called the meridian called Ren. And when you get near the navel and below in that region, that's for mainly gynecological points. See, so usually acupuncturists or a person who does acupuncture, like myself, you use to sedate or tonify certain points in that area based on the presentation of the patient. Now, let's get back to the topic here, what I was talking about. Can tattoos negatively affect or impact the autonomic nervous system? So this is the article. This information you can get at PubMed, NIH. There's a lot of research with this here. Now, it says, yes, tattoos can potentially affect the autonomic nervous system through immediate stress and adrenaline responses. Go and say potential ink particle migration occurs, triggering systemic reactions like Asia syndrome. Asia syndrome is autoinflammatory syndrome induced by adjuvants. Adjuvants is anything or any substance that can trigger an immune response in the body. And they're saying this is in a predisposed individual, causing fatigue, muscle pain, fever, nerve pain, or dysregulation. This is very important. Ink components can also reach the lymph nodes and blood vessels, potentially causing inflammation or nerve interference. See, a lot of things that you take medication for has nothing to do with they can regulate or they can bring that body back into controlling that symptom, but you're not curing, but it's actually some interference going on in the nervous system there. Now, going back to the components and the migration of ink, and I'm making reference to the nanoparticles from tattoo ink, which travel beyond the skin to the lymph nodes and blood vessels, potentially affecting organs and nerves. With black ink, often linked to a higher concentration, according to the NIH. Muscle atrophy. You might see that in a patient who's had a stroke and they're not using a certain limb or joint or something. The muscles atrophy. But nerve damage. This has been linked to tattoos. Tattoo ink, like aluminum and other metals. You got heavy metals here. In the ink may act as adjuvant and trigger the immune system to overreact, causing it to attack its own body tissue. So what are we talking about? Autoimmune disease, lupus, sarcoidosis, rheumatoid arthritis. These are autoimmune disorders. Tattoos carry the risk of bacterial skin infections like MRSA, cellulitis, bloodborne viruses, hepatitis B and C, HIV, allergic reactions to ink, which may cause rashes or bumps, and inflammatory conditions like psoriasis can flare up. The article goes on to say, lastly, the relationship to tattoos and cancer has not been proven, but some inks contain known potential carcinogens, where recent studies do show an association with increased risk for skin cancers and lymphomas, especially those large tattoos that cover a greater body surface. The research suggests ink particles can migrate to lymph nodes. Here we go again. You know, your lymph system is what carry a lot of the fluids in the body, and it removes a lot and picks up a lot of the potential disease-causing agents, bacteria, fungus, virus, parasites. It's all in this lymph fluid and takes it to where it can be excreted from the body. And we go back to lymph nodes, where it said potentially causing inflammation and cell changes, but long-term effects are still being studied. Carcinogenic ingredients are your polycyclic aromatic hydrocarbons and heavy metals like mercury, barium, copper, and aluminum. Okay, so that is why I, not judging you based on the, this is basically fashion, but we do know fashion has hurt a lot of people. Look at women with shoes. The fashion designers design shoes that are opposite the anatomy of the foot, causing foot damage, requiring surgery, pumps. There's a tilt in the pelvis. The patient leans forward, backaches. They have to lean backwards to balance to keep from tipping over. Now, this is another article here. It says tattoos cause disease. Yes. Tattoo inks contain various metals, both as intended pigments like iron oxide for red, brown, titanium dioxide for white. Titanium dioxide is in some of your vitamins, so you have to be careful when you get these little white pearls. It contains titanium dioxide, and that's a metal. Copper for blue-green, and these are contaminants, including heavy metals like lead, chromium, nickel, cadmium, arsenic, mercury, all of which pose health risks, health risks such as allergies, inflammation, potential long-term toxicity through concentrations varying greatly by the ink. Now, what I want you to get from this here is the problematic disease potential. Let's see, because you don't feel anything yet, but it's coming. It may not show in any symptomatology until you have maybe some imaging tests, blood tests. It'll show up. If you go further into Chinese traditional medicine, TCM, they may have certain tests, in which I know they do, that'll show up before and give you information long before the blood tests do, before the imaging tests do. See, now it goes on to say that these substances, often from industrial paints, get injected directly into the skin, accumulating in the lymph nodes and the organs, leading to concerns about carcinogens through regulations which are not consistent. So we don't really know about cancer. We can't really say that. It's still being studied. And we do know that it takes 50 to 60 years before certain studies can be proven to say that this is an actual fact. So my suggestion is to, if you have, based on this information I just given you, if you have tattoos, you can use tattoo removals, because I'm going to tell you what's happening with that when you leave that on your skin. Because we're very concerned with the effect of absorbing geoengineering through the lungs when you go out, but you can kind of control that. Either you wear a mask, or you don't go out as often, or you control the your movements when you see geoengineering. But what about a situation where you have the heavy metal directly and constantly in control of your body? It's in your skin, and the skin is one of the main organs of detoxification. So you have to constantly be detoxifying these metals all the time. What about the fat deposition in the body? We know that most of your metals are stored in body fat. Here it's in the skin. This is an important thing. So let's go over some of the common metals here. Carbon, iron oxide for black and brown ink, red and yellow ink, cadmium, lead, manganese, and barium, blue ink, cobalt, copper, bromine, purple ink, tungsten, chromium, and iron. And then when we're looking at the heavy metals, the contaminants contain lead, arsen, beryllium, cadmium, chromium, mercury, nickel, and antimony. And it's the accumulation of these pigments where they migrate to the lymph node and lymphatic system that's causing the problem. And so you're concerned, like I say, about what's in the air. Here it is on your skin, and it's constantly being absorbed by the lymphatic system. So there's nothing that you can take for that. There's no supplement that you can take, even if you're getting one of the best ways to remove metals from the body is a combination of heat through sauna and the consumption of B3 or niacin, which we know is a vasodilator. That will help to open up the blood vessels, allowing you to sweat out a lot of the contaminants that's contained in body fat. But here, this is in the skin, it's constant. This is problematic. And I'm going to tell you right now, I do not acupuncture those patients who have what I consider heavy metal toxicity because of tattoos in those areas where the acupuncture points or meridians, the formulas for a certain area, for a certain condition, call for it, because I don't know exactly what it's doing to your body, okay, because you're already overstimulated, more sympathetic dominant than the average patient. Let's see. The other thing is you cannot use anything to detox until you remove. So here's a situation where you have to remove the contaminant and then move about to try to detox through saunas and niacin in that area, and or detoxify the liver. A detox program, it will not work. I'm telling you. We know that the colon is the seat of all diseases. You have to have colon therapy, but this is not going to be effective. Colon therapy, sauna, supplementation, diet therapy, when you have tattoos covering your body. So you need to get that removed first. That's the first step, and then go through your detox programs. Okay, I hope that's been helpful, but I want to address that issue because every physician will see patients covered with tattoos, covered with certain piercings, scars. We know the scars, I put tattoos, piercings in the same category as scars, which puts you at sympathetic dominant. We know that sympathetic dominant patients need more magnesium and potassium or a diet based on a vegetarian type diet to be effective. That helps to balance the sympathetic nervous system. And I'll talk more about the effects of diet on the sympathetic nervous system in the future, but I want you to know this because this is something that's cosmetic, that's causing problems, and is very popular. But I think if you value your health, this is something that you may want to look into, is having these tattoos removed. Okay, best in health.